Good morning. I am so grateful to Jennifer and the Northern Region Association of Safety Professionals for inviting me to share with you all this morning. These conversations about addiction and recovery in the workplace are so critical because the data shows that addiction has a devastating impact on the workforce and our economy. The misuse of tobacco, alcohol, and illicit drugs in the U.S. translates to $740 billion annually in costs related to crime, lost productivity, and health care. Excessive drinking alone costs the U.S. $249 billion annually. And this may be the most important point. Of the 20 million people in this country with the disease of addiction, nearly 70% of them are employed full or part-time. But everyone watching today and involved with your association has an incredible opportunity to build supportive cultures for recovery in the workplace and ensure that anyone who struggles with the disease of addiction or mental illness gets the help they need. I care so much about this issue because it's personal to me. I have been in recovery for over 18 years from an addiction to alcohol. And there were really two things that helped me find and keep my recovery. Number one, reaching out for help, and number two, a supportive work environment where my employer played a pivotal role in helping me find my recovery. I started to face my addiction when I reached out to my team leader at work and told her that I needed to talk about something very important. I started to share my story of slips and bumps and how I felt like addiction was taking over my life. And I remember just looking down and crying and feeling so ashamed and small and helpless. I was so nervous to look up and feel the judgment that I'd felt so many times in my life before this moment. But when I looked up, there were tears in her eyes and a look of compassion and understanding. I had expected complete disdain and judgment from her, but instead, she made me feel normal and supported. She looked at me and said, "Let's do this." And if not for that supportive work environment and awesome team leader, I know I would not be in front of you today, asking for your help to eliminate the stigma of addiction and supporting recovery-friendly workplaces across our nation. If the members of this safety association are interested in creating an environment that supports recovery, one of the biggest steps is working to eliminate the stigma that surrounds addiction and mental illness. We need to encourage everyone, from management to human resources to the employees on the floor or out in the field, that addiction is a chronic disease rather than a choice or a moral failing. In North Dakota, we conducted a statewide survey which showed us that 63% of North Dakotans believe that addiction is a disease. But that still means that 1 in 3 people believe addiction is a choice. Scientists, physicians, and even the Surgeon General, Dr. Jerome Adams, agree that addiction is a disease. In fact, alcohol was declared a disease by the American Medical Association way back in 1954. Having people understand the science of addiction is important, and understanding how stigma prevents people from reaching out for help and finding support. Data shows that only 1 in 10 people who need help for addiction and treatment will actually seek and receive treatment. With more people understanding that this is a health issue, but we believe that more people will reach out for help and more lives will be saved. When I became First Lady, I shared my story of recovery publicly for the first time in 15 years, which led the governor and I to create Recovery Reinvented. What started as a one-day movement or one-day event has now become a statewide movement to end the stigma and empower recovery across our state. I had spent the first years engaging with groups who already supported recovery, but knew we needed to start preaching outside the choir. So we started by engaging with the business community. I viewed every engagement with a business or a chamber of commerce as an opportunity to break down stigma that is often felt in the workplace and at networking events. In speaking engagements with our state's largest chamber of commerce and at the Amazon Web Services Public Sector Summit, I asked everyone in the room who was in recovery to stand and be recognized, if they were comfortable doing so. And let me tell you, you could have heard a pin drop in those rooms. But after the silence, people around the room began to stand up to applause and encouragement by their coworkers and peers, their supervisors, and their colleagues around the community. This is what a recovery-friendly workplace looks like. An environment where there is no shame in admitting that you are a person in recovery or that you are a person who needs more support, and being met with enthusiastic support by everyone you work with. The governor and I continue to seek these opportunities to engage business leaders in these conversations, hosting a dialogue with 50 CEOs from the largest employers in our state and communities, with recovery advocate and author William Moyers, to keep recovery-friendly workplaces in the front of their minds and ask what they can do to create change. A big thing that we found is employers are always looking for resources that can help employees who are struggling. In North Dakota, I believe we have one of the best behavioral health teams in the nation who have risen to the challenge, especially during this pandemic, to equip businesses with resources. Their website has a wide variety of resources that can help businesses, employers, and individuals seeking treatment with the information they need. People just need to go to behavioralhealth.nd.gov. We also have many resources on the Recovery Reinvented website with things like workplace toolkits and virtual resources at recoveryreinvented.com. I would recommend that everyone participating in this conference checks out their employer toolkit, which is designed to help employers supporting employees who are teleworking, utilizing an EAP, coping and self-care strategies, and finding behavioral health services and support. The toolkit also has tips for supervisors on how they can provide one-on-one support to their staff members, and ready-to-use information for employee newsletters or other employer communications on behavioral health resources, including tools for parents. Another resource for all employers should be aware of and considering incorporating into their business or EAP program are peer support specialists. Peers are individuals with lived experience with addiction or mental illness who are trained to provide support services to those in their midst of their struggles, whether it's supporting them to find housing, a job, or just emotional support. In North Dakota, we are doubling down on this strategy because it works. With this state being 50% rural, it addresses the need to have services in all the areas of our state. A final resource that you can encourage your employees to take advantage of is called Recovery Talk. This is a 24-hour-a-day, 7 days a week Recovery Talk hotline where people who are looking for help with addiction can speak to a trained peer support specialist with lived experience in addiction or mental illness to talk to them and receive support. The service is free, anonymous, and completely confidential. Many of you may aspire to create space for recovery or talking about these issues in your workplace, but maybe don't know how or what it could look like. Fortunately, we have an incredible manufacturing business in our own backyard that has created a blueprint on what a robust recovery-friendly workplace looks like. Solid Comfort in Fargo produces high-quality furniture pieces for Marriott, Hilton, Wyndham, and Best Western. 75% of their current employees either struggle with addiction or mental health and/or have criminal backgrounds. They have a strategy that attracts underdeveloped and underutilized pool of workforce through Solid Start philosophy. What started as a hiring strategy to attract employees, when at the time North Dakota's unemployment rate was 2% with 30,000 open jobs. Their program has become a workplace philosophy for change and erasing stigma. Solid Start actively recruits team members who were incarcerated. They have participated in job fairs inside state prisons and maintain relationships with probation and parole officers, local judges, and drug court administrators. They provide ongoing support to employees through manager training, peer support in the workplace, and internal checks and balances. This program has been good for their business. Their hiring philosophy ensures a continued and constantly filled pipeline of applicants, and they spend less than $500 on advertising their open positions. If your organization has concerns about liabilities with establishing a program like this, I would encourage you to reach out to me or my team so we can connect you with Solid Comfort directly. Their team has developed a risk rubric, that's pretty cool, to bring safety and consistency into the program, which has allowed it to thrive. And while this has been great for their business, Solid Comfort is also contributing to building strong community by helping empower people with second chances to remake their lives and achieve recovery. As I close, I want to again thank Jennifer and the Northern Region Association of Safety Professionals for inviting me to share and making this issue a focus for your conference. My team, Jenny and Joey, will be available to answer questions, and we're here to help in any way we can. The two most impactful recommendations I could make to support recovery-friendly workplaces are: number one, see if your company can contract with peer support specialists as an extension of your EAP program, or ways that you can support employees, which can lead to increased referrals and resources. And have senior level executives and managers eliminate stigma by openly talking about addiction and mental illness, which in turn creates a culture of openness and a safe space for employees to talk about the issues they face. Together, we can make recovery-friendly workplaces a reality across our state and nation. Thank you again for having me, and I wish you all the best through the rest of your conference.